Now let's talk about the diabetes mellitus. So we'll talk regarding various classifications of it, various types of diabetes mellitus are there, causes are there, pathogenesis we can say, how it is happening and how can we diagnose it, and also treatment part we will discuss and short and sweetly. So first thing, regarding the diabetes. So general over, whenever anyone say about diabetes, we self understood by diabetes mellitus. There is diabetes insipidus as well, malfunctioning of the areas either in the nephrogenic or the central region. But diabetes mellitus is the metabolic disorder. It's the metabolic disorder showing the features of the hyperglycemia. It can be, which can be due to the either insulin function deficiency or secretion deficiency, or it can be due to both the causes as I mentioned. So let's write it. It's the metabolic disorder showing common feature the common feature of hyperglycemia. Metabolic disorder showing common feature of hyperglycemia due to defect either in insulin secretion or its function or both. That's the basic diabetes mellitus definition. We can say it for the understanding terms. So if we talk about epidemiologically, it's a top 10 cause of the death in worldwide, and there is 346 million diabetes patients, and very much there are pretty much large populations who are undiagnosed as well. So we can conclude that this number that we talked about is higher than this because undiagnosed patients are there. So if we are talking about the diagnosis, then let's have the concept regarding the diagnosis. So in the diagnosis part, we can have the criteria given by the ADA, American Diabetes Association, or the WHO. So the criteria can be fasting blood glucose level, tested. It can be random blood glucose level, and it can be hemoglobin A1C, that is called glycated hemoglobin, or we can test oral glucose tolerance test. It in here we give 75 gram of standard carbohydrate solution and then measure the blood glucose after 2 hours. So let's say if the results came like equal or greater than 126 gram per deciliter of glucose, then we say it's diabetes. If it's 126 gram, then it's diabetes. And if random blood glucose is equal or greater than 200, then it's diabetes. If it is coming like equal or greater than 6.5 percentage, then it is diabetes. And if it is coming greater and equals to 200, then it's diabetes. So if random blood glucose once it came 200, more than 200 or equals 200, then we need not to repeat the test, whereas fasting hemoglycated and the OGTT tests should be repeated to confirm it. But random blood glucose, if it's coming in that range, it's diabetes. So let's say fasting blood glucose came in between 100 to 125, it is pre-diabetic. and if it's coming between 140 to 199, it's pre-diabetic. And then if it's coming 5.7 to 6.4, it's pre-diabetic. Whereas same thing about this can be said. So this is the diagnosis part that need to be understood by all the medical field student and learn as well. It's a very common disease. We can find it out in our society very commonly. Thank you. Next, let's talk about the classification. Regarding the classification, there is type 1 diabetes. It's the autoimmune disease. Type 1 diabetes is an autoimmune disease mainly, but it can be idiopathic cause as well. So in it, what happens is absolute deficiency of insulin will be there due to the autoimmunity process kills the beta cells, so there is no insulin production. So it's the type 1 diabetes. Then there will be type 2 diabetes. In it, there is insulin production, but the resistance of insulin means insulin can't work. That's why insulin resistance cause the diabetes, and that means the features of hyperglycemia. So it's type 2 diabetes. We'll talk about the pathogenesis in the later sessions, obviously. So in the others kind are also there which can cause diabetes, like there is monogenic form of diabetes. The two type of diabetes that we talked is very common, like 90% of the people are in this category and other remaining 10% are in here. But there are certain other kinds of diabetes as well, like these are the polygenic form of diabetes. That means various genetic factors have to go wrong to have these kinds of diabetes, of course with the support of environmental factors. But in monogenic form of diabetes, it's the mutation in the glucokinase or hepatocyte nuclear factors. Various types of it are there. Then it will have the diabetes because the uses of the insulin, like glucokinase, we all know how it is used in the glycolysis pathways. So it will, if a glucokinase is not properly working or it is mutated, then you will have the diabetic features, and then glucokinase controlling mutations will be called MODY2. Let's talk about the full form: mature onset diabetes of young. It's called this. This is the one thing that we should know. Other than this, there are various endocrine pathologies, and then exopancreatic defects are there, infections, various sorts of drugs like glucocorticoids, thyroid hormones and all can cause diabetes. Gestational diabetes is there. So because placenta and placental hormone helps or contribute in the insulin resistance, thus in the time of gestations there is chance of having diabetes. It's a diabetic susceptible period, we can say. Azur